So before discussing about this is actually FMR situation. But lower single molar, that will be most of our doubts. Either single molar or both 6 and 7 we may have to do it. Okay. So 6, if it is extraction case, 2 implants. If it is yield case, it may be 1 or 2, 10 to 11 mm, 1 implant, more than 12, 2 implants.
1 minute.
Yeah. 10 to, that mesodistal width.
More than. So you know how to repeat that?
Yes, yes. Definitely.
Oh, it has to be children.
See, this is the mesodistal width. If it is only 10 mm or 11 mm,
Okay.
1 implant is enough.
Okay.
If this is 14 mm, what will happen? If you place only 1 implant, here cantilever forces will happen.
So you didn't
The mesodistal cantilever will happen and the implant may.
So appo idhula vandu நம்ம
You have to place 2 implants then. So if this is 7, this is 5, the distance is 14 mm, then you have to place 2 implants.
You don't want to replace two. You went to replace 1 tooth, you have to replace 2 implants.
For molar? Yes, yes, yes.
அப்ப prosthesis means நம்ம 2
Single molar.
single one.
Single molar connecting 2 implants.
1 minute.
Yeah, please.
Sir, on doubt, sir. If normally, implant should be 3 mm and implant to natural tooth should be 1.5.
Yeah, so when you place 2 implants, you have to do a good planning. Otherwise, you may end up in this implant close to natural tooth or the implants close to each other. So you have to select the proper implant design and proper
Like a smaller size.
yes, minimum diameter and proper location you have to select. So this is a little critical situation. But you have a 3.5 mm diameter implant, so you can fill it this. See, if it is a conventional implant, the design is like this. Okay. But if it is a compression implant, it is like this. So as you go towards the tip, it's getting. So you have got a lot of bone here. So placing 2 conventional here is difficult actually. Placing 2 compression implants is quite easy because the implant tapers very much. Okay. So why 2 implants? Yeah, to avoid cantilever. To avoid cantilever for long-term success, because the patient is going to eat 3 times a day. How many times per month, per year, another 10 year, 20 year, 30 year. So it is not for a short-term treatment. So when the patient asks, no, they may ask for 1 tooth, why you are telling 2 implants. So we should be in a position to explain it. So if the patient is engineering now, they will understand the cantilever issue. So long-term success. And 6 is the main tooth, one of the main tooth which take up the load. Okay, it is not some other tooth. So we have to definitely give it. And you need to have a good sleep. If you put 1 implant, if it fails in 1 or 2 weeks, then you have to remove it for some time, then again place 2 implants, totally you will be placing 3 implants, this kind of clashes. So
So the situation will be like most of the cases we place 2 implants only.
yes.
So that is for both extraction cases.
Extraction it is definitely 2
Two
implants.
implants.
See, this is 6, so this is 7. So 2 socket is there. Here 1 implant and here 1.
Any of the socket only.
Any of the socket. Both basal socket and distal socket.
இப்போ இங்க சார் லைக் எக்ஸ்ட்ராக்ஷன் கேசஸ்ல இப்போ பேஷண்ட் நம்ம ஐஓபி எடுத்துட்டு அந்த ரூட் அபைஸ்ல கொஞ்சம் அது வரைக்கும் நம்ம போட்டாலும் போதுமா லைக் நீங்க சொன்னீங்க இல்லையா கீழே வரைக்கும் யூ ஆர் நாட் சப்போஸ் டு அந்த லிங்கல் ஒன்று சொன்னீங்க இல்லையா கார்டிக்கல் என்கேஜ்மெண்ட் அது இல்லாம நம்ம இந்த மாதிரி பண்றச்ச அபைக்கலி வரைக்கும் அதை ஹோல்ட் பண்ணா போதுல we have the socket wall இல்ல
First we will finish the healed cases, single implant. Okay. So what are all the things to check? So how your implant gets stability, first we should understand. How your implant gets its stability. From where and all it gets stability? From the crestal bone. Okay. Which part of the implant gets stability? From the C1. So this part goes and sits here. So this part gets stability from here. That we will feel only during the end of the insertion. Only during the end of the insertion, this part goes to the and from this bone, this intramedullary bone, it gets stability. And if there is any cortical bone, lingually something is there. So from three areas it gets its support. One is from C1, and another one is from C2, and another is from the medullary bone. If all the three bone quality is good, you will be getting good stability. If something is missing, then the stability will be differ according to it. Okay. So these things we can see in the see this is a 6 healed area. Just we will analyze this. Okay. 6 the crestal bone. How much thick it is and how cortical it is. Both are important. How much thick it is and how much cortical it is. Sometimes what happens, the cortical bone is very thick. The cortical bone is very thick and wide. Okay. So you will be placing implant. So this part will sit here. Right? If the cortical, crestal cortical, the C1 is something similar to C2, you will have difficulty in placing the implant actually. 80% will go inside, but when you cross the 90, 100, you cannot able to insert. So you may have to widen this little bit using a bigger. Okay. If this is very thin, this is not a problem. Okay. And what is the quality here? Here somewhat it is quite decent. It's not very great, but however when you place compression implants, it will compress and can we get lingual cortical engagement, something like that? It is difficult actually because the myeloid ridge is not started yet because it's the 6th area. Maybe in the 6th distal root we may get. So this is the 6th mesial aspect. This is the 6th distal aspect. Distal root of 6. You can see the myeloid ridge is starting. Once you go to 7,